So hello everyone, my name is Aline Sigler. I'm a specialist with Provider Outreach and Education. Also on the line with me today is Karen Curtis. So you'll see her adding things to and monitoring the chat. I want to thank her for being our co-host today and for helping me to have things run smoothly for you. Most of all, I'd like to thank you for joining us for this session of our Modifier Monday series. For the last year or so, we've been holding short educational webinars, usually about a specific modifier or a set of related modifiers. Last month's session was titled Tools of the Trade. So if you're just beginning your Medicare journey, I would highly recommend that session. You can view it and other past sessions on our Modifiers playlist. I'll have Karen add a link to that in the chat. And then be sure to watch for future webinars in our weekly education listserv, and then also on our live events web page, the same page that you go to get the PowerPoint for the webinar that you're on is also in our training center where you can find those encore presentations. This slide is here to let you know that the information that we're providing today is accurate and complete to the best of our knowledge, but Medicare does change, and sometimes the federal regulations are hard to understand, so that's why we try to break them down into regular language during our webinars. But know that whatever laws and regulations that CMS has in place, if they change, we'll of course take precedence over what we've presented during this webinar today. And then finally, CMS does prohibit recording of all of our presentations for profit-making purposes. So they're for educational purposes only. They are in no way built to guarantee payment or anything like that. And so this is our legal disclaimer here that we include with all of our education. So what have we joined together to cover in this session? So first, we're going to start with defining what modifiers are. You may have heard of them, but you're not quite sure what they are, why we have them, and what to do with them. We're going to discuss the role of documentation and what it plays in the use of modifiers and how to build them on your claim form. We'll compare the different types of modifiers that you might use, and then throughout the presentation, we always like to sprinkle in resources, places where you can find more information on the particular topic that we're educating on. This slide, and we have them in most of our educational events, is a list of the acronyms that we use when we're preparing the education. So this is a list of the ones that either are on the slides or that I specifically know that I'm going to mention. And we do this for a couple reasons. First of all, Medicare is full of acronyms. Nothing is called by its real name, it seems like, in Medicare. There are acronyms for everything. And so trying to keep them straight, especially for those of you who might be early on in your Medicare journey and learning about Medicare, that it's hard to memorize all those. So giving you a place where you can go back and look at those and jog your memory. Myself, even after 27 some years, I use acronyms that I've kind of forgotten what they mean. They just kind of roll off our tongue. And so it's a good reminder for all of us as to what they actually mean. In looking over the list of people who registered for this education, we do have a wide variety of experience levels. There were names that I recognized from past education. So thank you all for tuning in today. We are going to start at the beginning. So modifiers, what are they? How do we define those? Modifiers are essential tools in the coding process. They are two characters, which could be letters, numbers, or a combination. They're added to a CPT or HCPCS Level 2 code. Using them provides additional information about the medical procedure, service, or supply, and that's done to more accurately represent what was actually done for the patient. So there's a whole list of codes. So these codes modify, hence why they're called modifiers, what was actually done for the patient. They help clarify how things should be paid or processed by changing the description of the service in order to improve accuracy and specificity. If you're new to billing, not just for Medicare, but billing in general, using the highest level of specificity is stressed in all of your coding classes, and you'll learn more and more about that. So improving the accuracy and the specificity is very important. They help clarify how things should be paid or processed, like I said. So think of it as a way to tell the story of a particular encounter. Maybe a coder uses a modifier to indicate a service did not occur exactly as defined by the code descriptor, but the situation did not change the code that applies. So there isn't a more specific code to choose. So we modify the code that is most accurate and most specific to give a better overall picture of what was done to or for that patient. A modifier can also give details that aren't included in the code descriptor, such as the anatomic site or the location of the procedure. Other examples when a modifier might be appropriate would be if a service has a professional and a technical component. There are specific modifiers that show that, I'm just using an example here, the hospital provided the technical component of a diagnostic service, but the interpretation or the professional part is done and is going to be billed by someone else. And so that modifier, while the code for that diagnostic test would be the same, let's say the hospital's billing for the technical component and the physician is billing for the professional component. It could be when more than one provider performed the service or procedure. So part of the procedure was done by one physician and another part was done by another, and we need to separate that out. The system needs to know that to avoid it being seen as a duplicate. If more than one location was involved. It could be if a service or procedure was increased or reduced in comparison to what the code typically requires. If the procedure was done on both sides of the body, so it was bilateral. Or the service or procedure was provided to the patient more than once. You know, we've had instances where a patient came to the emergency room, got treatment, was stabilized, was sent home, and then later in the day came back for another visit, another reason. And so those modifiers can help tell the system what exactly happened. Forgetting modifiers or using the wrong modifier can delay claims processing or even cause denial of payment. So this can result in rework, having to file an appeal or having to do a clerical error reopening. It can delay payments. So it can also result in loss of revenue. Things get denied, things get rejected. As you see here, some modifiers directly affect payment for the service, and we refer to those as pricing modifiers. Some are considered informational, but they're no less important in billing accurate claims to Medicare. We'll touch more on the difference between and compare pricing and informational modifiers in just a little bit. There are two types of modifiers that we need to define as well. They are level 1 and level 2. Level 1, also known as CPT modifiers, are 2 numeric digits. These are updated annually by the American Medical Association, the AMA. So for Medicare purposes, the explanation and the application for some modifiers might vary from those of the AMA. So keep that in mind when you're billing Medicare versus another insurance. The codes are created and maintained by the AMA, but for Medicare purposes, there may be a slightly different interpretation of that, and so keep that in the back of your mind when you're using them. Level 2 modifiers are alphanumeric or have 2 letters within the range that you see listed here. They are recognized nationally, but they may not be recognized by all payers. They are also updated annually, but this time they're updated by CMS, the Centers for Medicare and Medicaid Services. So we have CPT modifiers and we have CMS modifiers, known as Level 1 and Level 2, respectively. As you start to learn more about modifiers and Medicare in general, you'll realize that your knowledge won't come from memorizing the regulations, but it'll come more from knowing where to go to find the information you need. So I said we were going to look at resources throughout our presentation this morning. So this is our first one. It's the Introduction to Modifiers page on our website. So let's jump out to the WPS GHA website. I added a link to this to hopefully facilitate a smoother transition. I just want to confirm with Karen, are you seeing the WPS website?
Yes, I am, Aline.
Okay, great. You know, you never know if gremlins get into the machine. So you can absolutely use the search feature when you get to our website, but today I'm going to show you how to navigate to it. So you want to start with the Topic Center and choose Claims. Now, if this is the first time that you visited our website today, like it is for me, you'll want to choose your jurisdiction. So just for illustration, I'm going to choose J5 MAC Part B. I'm going to accept the license agreement. If you have your selection saved in your website, you may not have to go through that every time. But again, for those of you who are just becoming familiar, that's completely normal. So next I'm going to scroll down in the topics, and these are alphabetical. And so I'm going to scroll down. Sorry if this kind of messes with your eyes. And I'm going to land here on the topic of modifier. I'm going to expand that, and then I'm going to select the modifiers page. So this page just gives you kind of a jumping off point to some of the other items that we're going to be talking about today. But I want to pause and show you that this page also has a lot of additional information. If we scroll down to look at how some of these modifiers are grouped into related categories, just so that you know that that information is there. This may come in handy as you continue learning about Medicare. Now I'm going to mess with your eyes again and go all the way back to the top of the page. So now I want to select Introduction to Modifiers. So this is the screenshot that I have in the PowerPoint presentation. This page gives you those definitions that we just went over a little bit ago. And it also has some facts and reminders that you might be interested in. So I'm going to scroll down just so you can kind of see the type of information that's down here for you. Some different facts about reviews that may happen on or because of modifiers, documentation, and then some other facts. So just want to make sure that you're aware that that resource exists for you. I'm going to go back to the PowerPoint presentation. And next, we're going to talk about documentation. The Social Security Act, which is the law that put the Medicare program into place, it specifies that in order to be considered for coverage, meaning to be paid, an item or service must exist within a benefit category and be medically reasonable and necessary. Documentation links the delivery of care and the payment together. The medical record is extremely important to help paint the picture of the services that the patient received and justify their medical necessity. Add modifiers to HCPCS or CPT codes if the clinical circumstance justifies using them and your documentation clearly supports their use. So documentation is all that a reviewer has to see if what was done to the patient and for the patient was medically reasonable and necessary, and therefore Medicare payment can be made. So that's all a reviewer has. We can't see the patient. We don't know how your facility is laid out or what your office is like. And so we rely on that documentation to justify the service and also modifier usage. Some modifiers are set up to bypass certain claims processing edits. And so you want to make sure that you're using them appropriately. If Medicare has a restriction on applying a modifier, you should only use that modifier to bypass those edits if the restrictions are fulfilled, and you should never apply a modifier just to bypass an edit if the clinical circumstances don't justify using it. Knowingly doing this can be viewed as fraud. Now let's look at billing modifiers. If you work with physicians and non-physician practitioners, those professional charges are billed to Medicare using the CMS 1500 claim form or the electronic 837P equivalent. This slide shows the form locator or the segment that the modifiers will be populated in. I do need to make a clarification here where it says in the electronic claim segment SV101-2. That's actually the spot where you put the procedure code, and 3 through 6 are the 4 spots for the modifier. So I just wanted to clarify that with how that looks on the slide. Likewise, with facilities and institutions that send claims on the CMS 1450 or the UB04 claim form, your electronic equivalent is the 837I, and those locations are listed here for those transaction types, and so that's where you're going to place those modifiers on those corresponding claims forms. As we learn that modifiers are separated by code set, CPT or HCPCS level 2, modifiers are also separated by their purpose. There are 2 categories, pricing and informational, and we'll discuss those next. Starting with pricing modifiers, those are also called payment impacting or reimbursement modifiers. They cause a direct change in pricing for the code reported. If you have more than one category that's applicable for a procedure, make sure your pricing modifier is in that first modifier field to ensure proper payment. You don't want to take a chance with getting an incorrect payment or not payment at all because your pricing modifier was not in that first position. So it does take precedence over informational or other modifiers. So that's a good thing to keep in mind. We do have a pricing modifier fact sheet, so I'm going to be sure to show you that. We're going to jump back to our website and look at that. So here we are back on our general modifiers page within the claims guides and resources. And so you'll see listed here the pricing modifier fact sheet. So I stated that this was kind of your jumping off point, and so I wanted to bring you back here. So I'm going to select pricing modifier fact sheet, and we'll take a look at that. Now, pricing modifiers are specific to Part B. So make sure you've selected a Part B jurisdiction or you will not see this page. So I don't want you to get confused that way. This fact sheet not only lists pricing modifiers, but it also identifies which of those modifiers you should put in a secondary position if another pricing modifier is required for the code. So I'm going to scroll down here and you can see that some of them have asterisks or double asterisks, and then the description and the explanation of those is down here at the bottom to give you even more information. And so trying to put this all in one place as a fact sheet or a cheat sheet for you where you can have the most information at your fingertips is what our goal was with that. Back to the PowerPoint. Our other category is informational modifiers. Another name for them is statistical modifiers. And so they can affect your payment, but they're not considered pricing modifiers. So what they do is add clarification to a service or a circumstance. You have a couple examples here: a repeated procedure or an unrelated procedure. And I already mentioned that you're going to place these after your pricing modifiers. But even though they're not pricing modifiers, they can affect whether a code gets reimbursed. So they're still relevant to payment despite being described as informational. And I realize that this is more than we can cover in our introductory class today. But as an example, coders often use Modifier 59 to override Medicare's National Correct Coding Initiative, or NCCI, procedure-to-procedure edits. And what that does is it allows payment for both codes in that code edit pair. And so although no payment is made for column 2 code in most instances without a modifier, Modifier 59, just in the example that we're giving here, is classified as an informational modifier rather than a payment modifier, even though it can affect payment. So I hope that helps to clarify that for you. And so likewise, like we had the pricing modifier fact sheet, we also have an informational only modifier fact sheet. So if we go back to where we were, I'm sorry, get you to the right spot here. My website's acting up a little bit, so we're just going to start over, and this is good practice for us. Topic Center, Claims, scroll down to Modifier. I realize that was a little fast. And now we're going to choose the informational only modifier fact sheet, just so you can see what it looks like. I do suggest bookmarking these pages if you feel that they are something that you're going to use often, rather than trying to remember how to navigate to them. But of course, you can also use your search field. That's always an option for you. Your resource slide, if you've downloaded a copy of the PowerPoint, this is one of the last slides that you have, but downloading it will actually give you live links to each of these resources that we took a look at today. I'm going to pause right now. I'm going to check in with Karen. I know this is one of our quicker webinars and things go by so quickly, but just want to check in with her to see if any questions have come in.
We have not had any questions come in, Elaine.
Okay, I appreciate you looking. Thank you so much. The next thing that I want to talk about is something that is newer, but it is upcoming, and it's an exciting announcement about an event that CMS and Noridian are collaborating on, and it's a National Provider Enrollment Conference. So it's going to be in person, and it's going to be at the San Diego Convention Center in San Diego, California, August 28th and 29th. They have a list of different topics and different speakers, and so the start time and the end time each day for both of those days is going to vary. And so if this is something that you're interested in, or you want to pass this information on to your credentialing or your staff members that work with enrollment, this is a really good opportunity because there is no registration fee. So if you can get to San Diego, you can get 2 days of great information, and we just want to tell everybody about it and encourage you to check it out. So there is a link on this slide. Karen will also put it in the chat if she hasn't already. And so trying to drum up interest and get everybody excited about being able to meet in person and learn about all kinds of things dealing with provider enrollment. On behalf of myself, Karen, and everybody in Provider Outreach and Education, I want to thank you for your attendance today and participating in our webinar. We hope to have you join us on future education. Take a look at some of those past Modifier Monday sessions for more information. We also look forward to your survey feedback, so make sure you get your feedback back to us. So thanks so much, everybody. Have a great rest of your day, and you can now disconnect.